Hackensack Meridian Children's Health is comprised of 2 nationally ranked children's hospitals by U.S. News & World Report and are number 1 in New Jersey. Hovnanian Children's Hospital in Neptune and Joseph M. Sanzari Children's Hospital in Hackensack, as well as pediatric inpatient and outpatient services at JFK University Medical Center in Edison. With access to expert pediatricians and over 200 pediatric specialists across the state, Hackensack Meridian Children's Health prides itself on offering specialized pediatric medical care and surgical expertise. To learn more about Hackensack Meridian Children's Health, visit hackensackmeridianhealth.org/kids. Welcome back, everyone, to the Monmouth Moms podcast. We are continuing our family healthcare series with Hackensack Meridian Children's Health. Today, we're diving into a topic that is top of mind for every new and expecting parent making those first crucial healthcare decisions for your baby. We are joined by experts from Hovnanian Children's Hospital at Jersey Shore University Medical Center, which is always a mouthful to say, which, along with Joseph M. Sanzari Children's Hospital, is ranked the number 1 children's hospital in the state by U.S. News & World Report. We have Dr. Moses, a pediatrician who will be guiding us through the world of childhood vaccines. And we also have Dr. Cathleen Ballance, a pediatric hospitalist and vice chair of quality and safety, who will shed light on a standard but often misunderstood newborn supplement, the vitamin K shot. Thank you both for being here.
Thanks for having us.
I'm going to learn a lot today because, like I said, when we were just chatting a little bit prior to getting started here, I feel like, things have changed a little bit in the world of vaccines, and also, just like certain things that I guess have progressed over the years. And my kids are a little bit older, so I'm not like in this, in this world anymore, right? So I'm excited to learn more. Thank you for coming. I'm going to start with Dr. Moses. We'll start with vaccines.
Okay.
For a new patient, the immunization schedule can look intimidating. Can you start by explaining why vaccines are so important, especially in those early months?
Yeah, so, the whole idea of vaccines really is to try to basically protect your baby from getting sick, essentially. That's just the bare bones of it. And, when your baby's born, the immune system, it's very, very immature. So the immune system is still developing, so if they're exposed to, let's talk about measles. That's a hot topic right now. If a baby's exposed to measles or the whooping cough, they can get really, really sick, and have a lot of complications from it. And that's why even when a mom is pregnant in the 3rd trimester, they'll offer you a vaccine called the Tdap, which has the pertussis vaccine, the whooping cough vaccine, and some of those antibodies are spread to the unborn child, so that when the baby's born, you're already kind of protected from the whooping cough in case you're exposed to it until you're 2 months when you start getting it as a baby yourself. So the whole idea is really just to kind of support that baby as the immune system is developing to prevent them from getting a lot of these diseases that frankly are still circulating in the world right now.
Okay. What is in the Tdap? It's pertussis, and what else is in it?
Tetanus. And then diphtheria also. So it's three organisms, or 3 vaccines in one, so to speak.
Okay. Many parents have questions about what's actually in a vaccine. Can you talk about the ingredients and the rigorous testing that vaccines undergo to ensure that they are safe?
So, in terms of the vaccine components themselves, they have, I'm not going to go into the long list of different things, but the basics of it is that there is a part called the antigen, which is the actual, part of the vaccine that stimulates or provokes an immune response. So think of, again, let's take measles, for example. In designing the vaccine, you take a part of the actual virus or a part of the actual bacteria, and then you use that to make the vaccine. That's the antigen. In some situations, they may take the actual organism itself, but make it a very weak version of it, just so when I'm introducing this vaccine into your body, you're actually not going to get sick from the disease. And the purpose of that antigen is to basically train your body to create what they call antibodies. Think of it as your army, your fighters, just so when this disease does show up, you have an army that's ready to fight them. The other way your body gets that army is if you get the actual disease. So if you were to get measles, your body will make an army from measles.
Right.
But unfortunately, you're going to get really sick from the measles while your body makes that army. But the whole idea of a vaccine is, let me give you the cheat code where you don't have to get sick and still make the army. So that's the antigen part of it. Then they have other things, something called an adjuvant, which basically helps, that with the vaccine, it prevents you from having to give so many doses of the actual vaccine itself. So the adjuvant is almost like a boost, right? It helps the immune system kind of give you a stronger response to the vaccine. Mm-hmm. And there's other things, preservatives and stabilizers, and all of those things are just there to ensure the vaccine is safe, to ensure the vaccine doesn't break down when it's exposed to heat, storage, and transport. So all of the components of the vaccines are not only for the safety of the vaccine itself, but also to ensure that when your baby or your teenage child gets that vaccine, they're not getting sick from the actual vaccine itself. And then just to talk about the safety, there's so much that goes into a vaccine before it comes out, mm-hmm. right? There are preclinical trial phases where it's just in a lab, they're testing maybe on animals and things like that to make sure not only is the vaccine safe, but also to make sure that it's something called immunogenicity, to make sure that it actually can provoke your immune system, to react. Before you now go to phase 1 trials, which is typically a small group of people you're using, maybe 100 or less than, checking for safety. Then you go to phase 2 trial, checking for safety and also, again, how effective the vaccine is. And then phase 3 trials, which is a large thousands of people, before you actually submit it to the FDA to say, hey, I think this thing is ready for going big time. So there's so many checks and balances that happen before these vaccines get to your pediatrician's office. And in some cases, there's even a phase 4 trial, so there's a lot of rigorous testing that happens before vaccines are deemed safe for the public.
Interesting. Okay. We often hear the term herd community. I will preface with, I have no idea what I've never heard the term herd community, immunity, yes. Not community. How does vaccinating my own child contribute to the health of the entire community? That's where I got the community from. Okay. So herd immunity, I have no idea what that is. Tell me what that is.
So herd immunity basically is the more people in a community are immunized from a certain disease, so to speak, from certain virus or bacteria, the less likely that virus or bacteria can spread amongst that community. Let's take a community of 100 people, for example. Mm-hmm. If only 5 of them have the measles vaccine and another 5 of them are immune from measles, excuse me. Or 5 of them are immune from measles because they had the measles. Now you have 10 people that have the antibodies in them. So if the measles were to come, there's a good chance it's going to spread through that community because only 10 people are technically protected and 90 of them don't have it.
Okay.
Now, herd immunity, which is the goal we want, when we want people vaccinated, is we want enough people to have it. For measles, for example, 95%. We want 95% of the population to have it. So if measles were to come into that community, maybe one person gets affected and that's it. It doesn't have anywhere to spread because it needs a host that hasn't seen it before. So if it were to go to this person, this person had measles already, it's going to go there and die as opposed to spreading to everyone around. So the more people are protected, the larger the herd. But the benefit of all of that is you have a 3-month-old baby mm-hmm. that is not old enough to get a certain vaccine. That baby is protected because the herd is vaccinated. The herd is immune from it. So that vaccine cannot get through to harm that baby. Or you have someone that perhaps is going through chemotherapy, and they're immunocompromised. That person, if they were to get measles, they can get really, really sick. So that person is dependent that the community around them is protected to prevent that measles from penetrating to them, so to speak. So the more of us are vaccinated, the more of us are immunized, the less likely any disease can spread and you have these like huge outbreaks.
Okay. Thank you.
Thank you.
No, that makes a lot more sense. All right. There is a lot of information online that can be hard to distinguish fact from fiction, especially I'd imagine with, everything that people are seeing on Instagram and YouTube and just looking up things on Reddit and just, you can really Google anything these days. What would you say to a parent who is currently making their vaccination decisions?
So in terms of getting information, the American Academy of Pediatrics is a good place to go to, aap.org. It's a good website to go to get information about all things pediatrics, vaccines, things like that. They also have a subdivision called Healthy Children. I really like that, healthychildren.org as well. It's very layman in terms of the way the information is put forth, and they have the search bar, whatever you want to find about vaccines, medications, different things, different diseases. There's education for healthcare professionals on there, education for parents that are on there, so you can just read right through that. And obviously the CDC also is a great resource in terms of, especially when it comes to vaccines, you want to make sure you're getting your information from trusted sites, because these are not just people that sit there and just type up stuff. Like, the information you're getting there are, been thoroughly peer reviewed. They've been studied over and over again. And frankly, that's a lot of the stuff that guides what we do. Okay.
So not WebMD.
Preferably not. WebMD is okay, but I like to go to the stronger resources, people that actually are on the ground doing this day to day. A lot of that information comes from pediatricians, clinicians, people that have actually been in the lab, seen patients, have lots of experience with the stuff we're talking about. So, yeah.
Okay. Dr. Ballance, let's shift to something that happens right in the delivery room. Many new parents are surprised to learn that their baby needs a vitamin K shot. Why are babies born with low levels of this vitamin? Yeah, what does the vitamin K shot do?
Okay, so vitamin K is actually an essential nutrient for blood clotting.
Okay.
And newborns lack enough vitamin K to protect them. The reason being is vitamin K doesn't cross the placenta from the mom into the baby very well.
Oh.
So as a source, also the bacteria in the gut normally produce vitamin K for, older babies and adults, but infants don't have that bacteria in the gut to produce sufficient amounts of vitamin K to protect them. Okay. Once a baby's born, breast milk is extremely low in vitamin K, and formula has vitamin K, but not in sufficient quantities as well. And so at birth, that's vitamin K is essential for blood clotting. Mm-hmm. And without the vitamin K from birth, babies are at increased risk of a condition called vitamin K deficiency bleeding, or VKDB. Okay. And vitamin K deficiency bleeding can result in very serious uncontrolled bleeding without any warning from birth up through about 6 months of life, and that's due to the vitamin K deficiency. Vitamin K allows the clotting factors in the bloodstream to be activated. So without that, blood clotting is impaired.
Wow. Okay. I didn't know any of that.
Yeah.
But they need one dose,
yes,
essentially?
Yes.
And then not again?
Correct.
Okay.
So, okay.
So actually that leads to the next question.
Yeah.
So if they're low on vitamin K, what is the risk, and what does this one shot prevent?
Right. So there's different stages of vitamin K deficiency bleeding. There's the early stage, which is in the first 24 hours of life, which commonly can be partially due to maternal medications that may impact clotting and vitamin K. The second stage is from 2 days to a week of age. It's called classical vitamin K deficiency bleeding. And that bleeding can often present as like oozing from the umbilical cord site. If the baby has a circumcision, they can have excessive bleeding from that. Then there's late vitamin K deficiency bleeding, which is from a week to up to 6 months of age. In that period of time, babies can be at risk for this more serious bleeding in the body, which can occur in the gastrointestinal tract, essentially anywhere, but the most dangerous form is bleeding into the brain, intracranial bleeding. And in fact, about 50% of babies who end up with vitamin K deficiency bleeding, and the late vitamin K deficiency bleeding presents as this intracranial bleeding, and that can lead to permanent brain damage and even death.
Wow.
Yeah.
And how soon can they present some of these symptoms post, after birth?
They can present from the time they're born through 6 months of age, and that's why the shot, which is, I think there's a lot of misperception about the shot itself. It's not an immunization and it's not a medication. It's a nutrient that babies are born deficient in. So the practice is to give 1 injection of vitamin K into the baby's thigh within the first 6 hours of birth.
Okay.
And because the vitamin ends up in the muscle acts as sort of a depot for the vitamin K, releasing it gradually over time. So that's why it provides a prolonged protection over months. Okay. So that's and that's recommended by the American Academy of Pediatrics, and it's been really standard of care since 1961.
Okay.
Yeah.
And now it's offered to the mother or to the parents?
Yes. I mean, since 1961, it's actually been considered standard of care and recommended by the AAP. And over, I would say, over the past several years, there's been an increase in parents refusing the vitamin K injection for their babies at birth. And it's pretty alarming to us pediatricians because we know what can happen to babies, and we don't know which babies are going to end up with the vitamin K deficiency bleeding.
Right.
So it used to be that about 3% of parents refused vitamin K, but the more recent data indicates about 5% of parents are now refusing vitamin K. And at our particular hospital, we've had months recently where there's up to 10% of parents refusing the vitamin K. So, we're working hard to try to provide, scientifically based information to parents so that they can make an informed decision about the vitamin K shot.
Okay. So there is an oral vitamin K drop. Some parents are wondering if that is a better or safer option than an injection. Why is that?
Yes. So as I described, the injection provides immediate care as soon as within the first 6 hours of birth, and it lasts months. Okay. The oral form, first of all, is not FDA approved. Secondly, there are a number of different formulations out there, and you can get it like over the counter, which is not a good idea because there's different types of vitamin K as well. And the oral vitamin K doesn't have great absorption in the baby's intestine. It has to be given multiple doses over a few months' time. So, and if the baby, it's not absorbed reliably in the intestine. And there's actually been studies that show that the oral form is not nearly as effective as the one-time injection at birth in preventing that serious form of intracranial bleeding, that late form and the most devastating type of bleeding that can occur.
This is off topic, but is that the case with like all vitamins?
No, not
like if you take like a gummy vitamin for kids or adults, like I've read that that it doesn't absorb the same way. So is that the case? Like
yes, that's true. It's people have different absorption capabilities in the intestine. That's why when children are admitted to the hospital and require antibiotics, for example, it's given intravenously initially. Mm-hmm. Some oral forms of the same antibiotic are not absorbed well enough to treat the condition.
Okay.
So the same thing with any kind of, medication or even vitamins. They can be variably absorbed by different people.
Yeah, and I guess depending on like the capsule and stuff like that too. I don't know.
Yeah, there's yes.
So it's very interesting to me. For parents concerned about giving their brand new baby a shot, can you clarify what this is and what the side effects are?
Yes. Well, first of all, the American Academy of Pediatrics has been recommending the vitamin K injection since 1961. So we have 60 plus years of experience that show that it's safe and effective. The vitamin is what we call a fat-soluble vitamin. So in the preparation of the vaccine, there are what's called emulsifiers that help it stay dissolved in the fluid liquid material in order to give the vaccine. There are many forms of the that's not vaccine, the shot. There are many forms of the shot out there, and at our hospital and probably many of the hospitals throughout the HMH network, we use a form that's free of added preservatives. Okay. So there's one preservative in particular called benzyl alcohol that people worry about, but in the forms of vitamin K that have the benzyl alcohol, it's in tiny amounts, and it's been shown again over years to be safe and effective in preventing vitamin K deficiency bleeding. So babies, this is really important that I forgot to say that. So infants who don't receive vitamin K are 81 times more likely to develop vitamin K deficiency bleeding than those babies who have gotten the vitamin K shot. And it's the incidence of this bleeding BKDB is about 1 in 25,000. So it's not 1 in a million.
Right.
So we feel, as physicians, that the risk-benefit ratio is worth a baby getting a one-time injection that's been proven over 60 years of experience to be safe and effective in preventing this catastrophic type of bleeding.
Interesting. Do children and adults, like if they develop vitamin K deficiencies, like can the same thing happen? Like if you're not getting it through your own nutrients?
Oh yes. So most children beyond 6 months of age, the body has enough bacteria in the gut to produce vitamin K on its own, and that provides protection from then on. However, in certain illnesses or conditions, when the vitamin K goes low, so, for example, serious overwhelming bacterial infection in the body, right. The consumption of the vitamin K can be deficient, and it could result in problems with blood clotting and bleeding.
Interesting. Okay. Good to know. Mm-hmm. All right, Dr. Moses and Dr. Ballance, this has been very clarifying. Very, I learned a lot today. It highlights the importance of having conversations with your trusted medical professionals, and if you are having those questions, to seek support in your community, right? Mm-hmm. And having also comprehensive resources available to you that are trusted and available to you through your pediatricians, and also obviously through the American Academy of Pediatrics. Yeah. Yes, Kate. Okay. A new online resource is now available. Oh, this is cool. Through Hackensack Meridian Children's Health. Visit hackensackmeridianhealth.org/vaccine facts. I like that. Yeah. Good to know. So we'll put that in our the caption for this podcast, and also on our website too, so you can find that information there. Thank you so much for joining us today and sharing your expertise and helping moms out and dads in their new journey of parenthood.
My pleasure.
Thank you.
Thank you so much.